Hello, and thanks for joining me tonight. My name is Mike Tellerino. I'm the CEO of K9 for Veterans. Tonight, we've got two really important guests with us. We got Zachariah Jet, who is our spokesperson for the Midwest, and we got Tina. Tina, help me.
Konieczki.
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 I just read that.
You did.
Anyway, Tina, I want to thank you for being my guest tonight. Tina, we're here tonight to talk about insurance. A lot of our veterans, and I think general public, are really confused what's out there that would benefit them as opposed to what's out there that makes no sense at all for them.
Yeah.
So veterans may be confused about what Medicare and why it's important for veterans to be aware of what Medicare covers, and do they coordinate benefits with the VA?
Some great questions, Mike. So there's many reasons for veterans to be aware of how Medicare works and what it covers, right? So having both coverages, you have the freedom of choice and the freedom and the choice to receive care from civilian doctors and hospitals. So you have more healthcare options. They don't work together, but both separately, very important. VA benefits are not really considered health insurance, the regular VA benefits, and there are several levels of VA benefits out there. Medicare doesn't coordinate the benefits, though, with the VA, except in some certain circumstances, and it's not guaranteed, obviously. There may be benefits with the VA covers that Medicare doesn't cover, and vice versa. There are some benefits that Medicare covers that the VA doesn't cover.
Can you have that?
You absolutely, and they do encourage it, right? Because so if you only have VA benefits, you can only receive coverage from the VA, from a VA facility. And then with Medicare, your Medicare coverage, you can only receive coverage from a non-VA facility, a civilian doctor, a civilian facility.
Right. So you have to go, if you had both coverages, you can go to either or then.
Absolutely. So obviously, if it's a VA, the VA is going to where your coverage is going to be. If you have Medicare, you have a variety, obviously, of more doctors and hospitals. So you have that freedom of choice to go to an abundance of other doctors and facilities.
Zach, yes. I don't use the VA for anything, for medical at all. I have my own insurance. Zach, what's it like going through the VA for their insurance?
Well, with the VA, it's like jumping through hoops a lot of times. So you have to go and talk to the VA first about an issue. If you have something like you need to go to the emergency room for whatever reason and you're outside the 45-mile radius of the VA hospitals, you have to call and get pre-approval, and that can take up to 72 hours. So if you have something that's fairly life-threatening, kind of a hassle. You can go ahead and go to the hospital, and they'll try and go on your behalf to get everything done for the VA, but it's not a guarantee. I know a few years ago, I got a bill for going to a local hospital for the VA. I didn't know I was supposed to call ahead of time to get pre-approval.
Right.
And I'm 62 miles away from the VA, the closest VA hospital. So I got a bill for like $1,200 for going to the ER. Well, after disputing it and everything else, the VA finally paid it. But it was a hassle. It caused a lot of headache on my end.
So it does benefit, then to have the VA insurance, a supplemental insurance, private insurance.
Correct. I hear that story a lot, Zach. It's definitely having the opportunity to go somewhere local and nearby. So I hear that a lot. So I have a lot of clients that are veterans that appreciate the fact.
Freedom of choice is the key.
Absolutely. Yeah. Absolutely. Yep.
I guess, being part of the VA, like Zach just said, it's a hassle to go there. It really is. Even for your prescriptions, it's a hassle. So how does the prescription cards work with insurance?
So, well, for Medicare Part D, all right. So Medicare Part D works really well with the veterans because when you go to a VA, you know, a lot of times there's a long distance to get to, like what you were saying, Zach. The distance is a huge issue. And they're great for your maintenance medications, right? You can get them delivered to you, or, you know, you can go get them. So that works really well. But there may be a drug that's not on the formulary, for one. For two, sometimes you just may need a upper respiratory infection, something like that, where you want to go to a local pharmacy, or you're traveling or something like that. So the one great thing about Medicare Part D for your prescription drugs is that with the VA, actually, it is actually credible coverage. So you will not incur a penalty if you just had the VA coverage. But the benefit of having a Medicare prescription drug plan benefits you, so you can go locally and get that prescription drug right in your local neighborhood, local pharmacy, if it's needed. Absolutely. And again, they may have a drug on one of the Medicare plans that may not be covered. As you know, the Medicare with the VA, they have a lot of the preferred generic drugs, but some people may need some of the, you know, stronger drugs or higher tier drugs that may not be available at the VA, and you can get it on some of the robust formularies that Medicare Part D offers.
What would you tell our veterans watching what they need to watch out for when they're purchasing insurances? What are some of the pitfalls?
Well, basically, when you're looking at Medicare, right, because there's a variety of companies in each one of them have a variety of plans. It's really important to look, like what I do with my clients. I look at who are their doctors, what prescription drugs they are on. You definitely want to make sure your drugs are covered on the formulary, for one, at the lowest cost, right? You want to make sure your doctors are included in whatever plan that you go with. So those are the two biggest things, is making sure that you're getting the benefits that you're seeking and at the lowest cost. So those are really important.
I know I see these commercials, as we were talking earlier. I'm like JJ's always telling you to call this number to see if you're entitled to any extra money, any extra benefits for eyeglasses, dental, or whatever. Tell me a little bit about that. Should they call those places?
Well, actually, I'm a broker, so I represent most of the companies that offer Medicare options. So I look to, you know, I'm local, so I'm able to sit down with somebody and really address what their needs and concerns are, and help them to see all the different companies that offer these Medicare plans, right? Where when they're calling an 800 number, they may get somebody, you know, in some other state, someone they're never going to see, someone that's not going to be there. Actually, they'll never be able to, you know, when you call an 800 number, you're never going to get the same person again, because it's a call center that you're calling into, where you have that personal attention. When you have a broker like myself that can sit down with you and address all your needs and really see what your concerns are. A lot of those commercials are misleading, only because it says, you know, it talks about all those, getting all of your Part B back, or, you know, telling so it all is based on, you know, are you available for are you eligible for Medicaid? Because the Medicaid helps pay that Part B back. Some plans do give some of the Part B, but not all of it. And there's actually some plans that have, you know, veterans in mind, that have some Part B give back in them, but none of them have where it gives back all of your Part B, like some of these commercials allude to. Yeah.
Is there a cap on medical?
No, there's not. Not on with a lot of these plans. No, there's not a cap.
What about for the prescription part of it?
No, well, actually, on the if I understand what you're talking about, some of the Medicare Advantage prescription drug plans and Medicare Advantage plans, they do have a max out of pocket, if that's what you're alluding to.
Right.
But on the drugs, there's not. So there's 4 different tiers on the drug plans, and all depends on what drugs you are taking, and what tiers they are will dictate, you know, throughout the year what stage you end up going into. So there's 4 different stages: a deductible stage, an initial stage, a coverage gap, which is also considered a donut hole, and then your catastrophic. And the one thing about prescription drugs It's same thing, same model across the country. There is no cap on prescription drugs. That's why it's so important to understand, to know which plan your drugs are at the lowest cost.
Well, that's why I go to a broker like yourself, and we're going to tell our viewers on how they can reach you, especially our veterans that I'm sure, like me, like Zach, we have a lot of questions that we're just not sure of, and nobody that I've talked to so far has all the answers. You seem like you're really on top of it, and you know what would be the best program for a veteran.
Yeah, and absolutely. There's also a program out there through the state and through Social Security called Extra Help. And depending on what your income level is, you may qualify, and they help lower the cost of your prescription drugs. And some of your drugs may even be lower cost than what the VA may offer. So it is really important to check your extra benefits to see, or extra help program to see if you qualify for that as well.
Well, Biden just passed some kind of bill with the prescriptions to put a cap on. I think it's for insulin.
Yep.
So they're working on that. None of that's going to be implemented yet, right? Until 2024, 2025, 2026. So they're still working on that. There is an insulin savings program out there that states that some of the insulins will be at $35 even through the donut hole, which there are a lot of plans out there that have already implemented that program, the insulin savings program, which saves a lot of money for a lot of beneficiaries, Medicare beneficiaries. Yeah.
Zach, you go to the VA, you get your prescriptions from them.
Yeah.
How does that work for you?
So you have to plan ahead a lot of times because, I'm quite a ways away from the VA. And if you have something like a specialty drug that's a little bit harder to get approved, it definitely puts a hindrance on everything. I know a while back there was a specialty drug I needed to take, and it literally took 2.5 weeks to get it approved while I was trying to deal with my issues that were going on. Right. So, and then not to mention the extra 3-4 days it takes to ship the product to your door. So,
or travel all the way to the VA to get it, right?
Yeah, and then you're standing in line waiting for 2.5-3 hours for a prescription.
Yeah.
That's crazy. That's crazy.
Yep.
I know. Insurance is a very complicated issue. So somebody who is well versed on it as you are, you're the go-to person because you could explain it in layman terms so our veterans would understand it.
Yeah, absolutely. Yeah, I do a lot of Medicare seminars teaching on Medicare only because I've encountered with so many people that have had misinformation, doesn't really understand when to enroll or how to enroll, where to go. And so that's why it's important. And, there's no cookie cutter plan out there, right? So everybody's individualized. I have veterans whose spouses are civilians, right? So they may be on 2 different plans. Every person needs to look, not what my friend has or my spouse has or my grandparents had.
Right.
They have to look and see what's in their best interest. And so, as well as the VA has a lot of great benefits, but there's a lot of things they don't cover. And, obviously what we talked about, the long wait times, the getting the approvals, not having the drugs on the formulary. Think about this. How many people really like their doctors and want to feel the comfortable with their doctor, right? They're sharing their personal information and they want to see that same doctor for years to come. And right. Zach, you may know this as well. At the VA, there's a pretty big turnover with doctors, right?
This was one that just came up today. I had the same doctor for 2 years. Before that, I had the same doctor for 2 years. Right. So it's about every 2 years, a primary care doctor is going out the door because the VA, they pay off all the student loans for the doctors, and then they turn around, and as soon as they do their contract with the VA, all their student loans are nullified, and then they go on to make 6 figures.
Exactly.
So.
Yeah, that's a big concern to some of the vets that that I've worked with, and they want, they want someone that they can know is going to be there tomorrow. Not that it's guaranteed that their doctor is going to be there forever. Obviously, different situations happen, and they change or they retire and things like that. But for the most part, they like to keep a doctor for quite some time.
Are there different prices with these different plans?
Yeah, absolutely. Every company has a variety of different plans. That's why it's important to look to see, there's HMOs and PPOs, there's private fee for service plans, there's, MSA plans. There's a variety of different types of plans. That's why, you have to look to see which one offers what fits your needs and your budget, your wants, your needs, so that's why it's important to sit down and look at all of that.
Again, what should a person who's calling in for the insurance quote, what should they be most aware of?
Well, one of the biggest costs obviously is the drugs. So when I sit down with a client, obviously you ask them what's their concerns, and then you find out what their prescription drugs are. So you have to make sure they're on the formulary, because that could be devastating if their drugs are not on the formulary. That's the first and foremost. Then you look and see, like, do they travel? I have clients that are snowbirds. They're in different states at different times of the year for several months. They want to make sure they have coverage, right? A lot of states may not have a VA where they can go to the VA. So at least that they can go and find a local wherever they're at throughout the country. So there's local plans, there's national plans. So you want to look for a plan if you travel, especially that you can have coverage nationally. So that's really important as well.
Coverage and see if your prescription drugs would be covered. If you want them for any kind of illness that you have, if to make sure that they're covered.
Yeah, and absolutely. And a lot of the Medicare plans also, they have a lot of benefits that are not covered by the VA that are just that are very important, right? So vision, it has a lot, we want to make sure we can see properly, right? It affects everything in every area of our life. Our hearing, I know the VA does offer some hearing, but there's some low cost hearing aids. There's dental. Our dental is huge. It's important to get those cleanings. And if you don't have dental coverage, I've had people come to me that has not had dental coverage for years and had some infections that turned in some major situations because they didn't have the coverage to get it taken care of. So these are all wellness things, over the counter. These are all costly that are covered on many of these plans.
So the average person picking up the phone, calling one of those numbers off the commercials, they're in trouble to begin with, because they're not going to really fully understand what's tailored for them by
Right.
somebody like you said over the phone that really doesn't know who they are.
Right. A lot of times they just, they're looking to, yeah, and they're looking to make a sale, right? Mine is about relationship and really being an advocate for my clients and helping take the time to really help them to fully understand what they have, what else is available to them, so they can be fully, insured according to their needs and wants.
That's amazing. When I think about all the insurances, it's for me, it's mind-boggling.
Well, also with VA, I've had veterans come to me that are Medicare eligible, either 66, 67, and had no idea because they only go to the VA. They had no idea that they should have picked up Medicare.
Well, why would they do that? Why, if they're going to the VA, why would they need a supplemental insurance policy?
Not so much supplemental. Well, I would encourage them to do that, but I'm talking about straight Medicare Part B, which is your medical, right? So if they do not get Medicare Part B, there is a 10% penalty. If they choose to go, like I've had clients that come to me at age 66, 67 that never enrolled in Part B, but now because of an illness or a circumstance where they want to go to a learning hospital, like University of Chicago or Rush or Northwestern or something like that, or they need to get a second opinion, say they got diagnosed with possibly like maybe cancer or one of those, illnesses, and they want to go there, well, they have to rely on the VA. right? There's long wait times and different things like that. So if they want to go and get a second opinion, or as I say, go to a learning hospital and go to some of these top doctors in the country, then they would have to enroll in Medicare Part B. Well, because they didn't do it when they first were eligible during that 7-month enrollment period, their initial enrollment period, now they have to wait for what's called a general enrollment period, which is called GEP. And that's from January 1st to March 31st. They enroll during that period of time, and then their Medicare won't even take an effect until July 1st. So they can't even, that's a long period of time
Be without
to be without that kind of, or not even get the coverage they're looking for because of that penalty. And now they have a 10% penalty per 12-month period they didn't have Part B. So that the penalty never goes away, right? So it's not going to be immediate coverage. So that a lot of people don't realize that, don't understand that. They figure I'm getting insurance from the VA. Why do I need anything else? Until something arises, and then they're like, wow.
It's not there.
Right. They've regretted not doing it.
Why don't you tell our viewers how they could reach specifically you to get some personalized insurance information?
All right. Well, I'm local. I'm in Tinley Park, and I'm at 16557 South Oak Park Avenue. My number is 708-539-4012. And you can also look me up at tkinsuranceservices.com on the website, and I'm on various other outlets like Facebook and LinkedIn. So there's a lot of places you can find me. I do work with a lot of the communities and giving back. We do a lot of fun events just really to get back to the community, and also for the veterans at the VFW Hall. So I love to support my veterans. Both my boys are veterans. I have a Marine and an Airman. So very dear to my heart. I thank every veteran, especially all of you that are watching today. I just thank you so much for your service. It just, what kind of country we'd have without you guys. I just thank you so much for that. So.
Well, I appreciate what you did for our veterans. I really do. Because like I said, I know myself, I get so confused with all these commercials. You need this, you need that, you should get this and get that. It's like, so unless I go to somebody like yourself who's that well versed and could point us in the right direction, we're never going to know if we got the right coverage or not.
Right. And, I have a lot of veterans. They're so worried about, the coordination of benefits and that kind of stuff. They don't coordinate together, but you can use them, right? So like I had one client was telling me he went to the VA, got his knee checked on, and then he went to another doctor, same exact day, right? And he got his knee checked on because he wanted to see both doctors in the same day. And you're able to do that because they don't coordinate and it won't hurt you. I have clients that have, no cost, zero premium plans, right? They don't use it, they don't lose it, but they get to use all the extra benefits that come along in that plan, the over-the-counter, the gym memberships, the wellness memberships, the dental, the vision, the hearing. You get all those benefits, right? So why not take advantage of some of these plans that are out there? And it gives you a lot of benefits that the VA doesn't offer. And, the freedom of choice, that's huge. And there's companies out there that really have veterans in mind when they created some of the plans. They give some of the give back. There's MA plans, even someone who's on TRICARE, right? That they're like, oh, I love my plan. I don't pay anything. There's no max out of pocket. They may be still interested in it too, because they can get an MA plan that doesn't have a drug plan, so it won't affect their plan, but they get some Part B back, right? Everybody wants a little bit of Part B back. Everybody talks about that's what the commercial's about, right? With this economy.
To me, it's just overwhelming. There's so much you need to know before you decide on what plan to purchase. So, if somebody doesn't go to you, they're crazy.
I appreciate that.
Seriously.
Thank you.
Because, Zach, am I right?
Oh, yes, definitely.
We don't know the first thing about insurance. We know whatever we know how to do, we do. But I'm just saying, as far as insurance, I mean, that's a completely different animal. I mean,
yeah, that's why every year Medicare changes, right? Things go up. We have inflation. Your Part B goes up. The the formularies, everything, a lot of things change every single year. So I do over 150 hours of training every year so that I can stay abreast on all the changes, so I can better serve my clients and the community with what's going on with their Medicare options. So it's really
Tina,
important.
I want to thank you for being my guest tonight. I really do. Give us your contact information, because it's so important that our veterans know who to reach out to and somebody that's going to have their back.
Thank you, and I appreciate you asking me to be a part of this podcast. Is a pleasure, my pleasure and my honor. And again, thank you for your guys' service. And again, my name is Tina Konieczki. My phone number is 708-539-4012. My email is tina@tkinsuranceservices.com. You can check me out on my website, find me on Facebook. And reach out to me. I always get back to my clients within, or whoever calls, within 24 hours to really help you. And I take the time to help you truly understand what your options are. So,
And that's so important. Like I said, it's so confusing. It really is. There's so many different plans and premium costs and different benefits out there that I
sure.
don't think anybody really understands unless they're you.
Thank you. And things change all the time, so that's important, right?
Exactly.
So
But
it's
you'll keep an eye out for our veterans then, right?
all the time. Absolutely. Thank you
God
guys
bless
so
you.
much. God
Thank
bless
you.
you both.
Thank you. Zach,
Thank you.
thank you for being my guest tonight. It's been a real pleasure. And Tina, keep us posted on any future updates that are coming in that our veterans should know about.
Absolutely. Thank you.
God
Have a
bless you.
great
Have a
night. God
great
bless you guys. You
Thank
too. Thank you. Bye-bye.
Bye. Have a good night.
You too. Good night.